hear me and that my screen is visible. So first and foremost, I would like to express all my gratitude to Dr. Ahmed for inviting me for this, the second Somali One Health conference. And sorry, it's really an honor for me to be virtually with you today. And my wish was to be in person with you, but due to a conflict of agenda, I could not make it. However, I hope this is a beginning of close collaboration between me and Dr. Mohammed, to do more than what we can do today related to this conference. So he asked me to talk about a global perspective on governance and stakeholder engagement. So I would like to articulate this presentation around 6 points. I would like to start with the socio-ecological system. Why starting with the social ecological system? It's because these concepts emphasize on the fact that, like you can see in this picture, the ecosystem and social system are interlinked. So we cannot separate human from those two systems. So humans are part of the ecosystem and the social system. And we know that ecosystem functions and services are very important. As we know, about climate regulation, for instance, so that function will generate also some values and benefits. Benefit for the ecosystem and all the human living organisms which are part of that system. So looking at the social ecological system, it's also taking into consideration theories or concepts such as the resilience, the sustainability, and the vulnerability of the system. And you can see further, the link among, why using the social ecological systems can really help you to understand why having all the discipline in board, it's very important. Having all the discipline in board can be framed using the social ecological trait framework. Like in this picture, you can see, there's 3 dimensions. If you zoom in at the center, okay, the first dimension represents what's observable, in an urban environment. Like we can see here, we have humans, right? And other co-inhabitant species. And the different response when, they are interacting, there's a pressure leading to some functional ecosystem. And finally, alteration of the, of this dimension. That will lead, if you look at the arrows, that will lead to a specific, consequences. Now, those consequences can be understood when we look the second dimensions of the social ecological system, which is characterized by a feedback loop between those effect outcomes and individual and collective perception. And then the third dimension here is related to the disease, decision support, meaning, all the ecosystem planning management embedded in the governance process and instruments. So using the social ecological system, the main point here is to understand that you need all those disciplines because they are generating a body of knowledge which will help you to better understand and integrate any solution. So any solution about health of humans, animals, soil, and plants, and we know that, our health, it's under pressure. There's a certain dynamic, through population growth, population goods, and movements, all of that are putting a certain pressure on the health of human, the animal, soil, and plants. In addition to that, we are facing deforestation, flood, drought, climate change. In addition to that, the urbanization, pollution, global warming, misuse of drugs and chemicals. So, of course, food demand, the increased food demand will lead to expand agriculture land, in addition of using water. So all those requests, all those needs are putting that pressure on our health, on our ecosystem, on our social system. As a consequences, we have a kind of externalities, right? We have externalities from food safety issue, security, food and security. We have resistance or drug resistance. We also have soil, plant, animal, and human communicable and non-communicable diseases. So we can understand why, again, using a social ecological system approach will really help us, to understand why One Health. So at the end of the day, it's about making sure that our community or it's at its optimal health, So, and to reach that optimal health, it depends also in, again, our ecosystem. If we understand that we are part of a nature and an ecosystem, we will then understand that, there's a certain number of parameters we need to take into consideration and which are interlinked to deliver to a community optimal health. For instance, health determinants. If you don't have a good understanding of all the, what are those health determinants, not only related to a human, but health determinants related also to the animal, to soil, to plant. So what are those health determinants related to, to our ecosystem, to our social system? And those who can generate that body of knowledge, it's through human competencies, So if you don't have very strong human competencies, it will be difficult for you to understand how those health determinants are interacting among them to deliver. The third dimension here is about leadership and governance, So you can have best university, strong human workforce. You can understand all the health determinants, but you need to have a good leadership and a governance. Of course, I will zoom in a little on the governance aspect. So that is not enough. You have a very good leadership governance. You also need a very good system, a system which will deliver, and all of this encompasses through having good policy, legislation, and strategy. So you can understand that achieving the optimal health, it's really complex. So you need all those elements, to deliver on optimal health of the community. And this figure, again, is to now zoom in on One Health. So what I talked about previously was to understand the rationale of One Health beyond, zoonotic diseases, antimicrobial resistance, but putting up front the big picture. So this picture here is a kind of a summary, showing that our shared environment here, our shared environment can be impacted by communicable and non-communicable diseases and issue of antimicrobial resistance. Same thing for safe food and food system. We can have same issue here, and also same issue regarding shared medicine and intervention. So all of these are interlinked. So if you don't understand what are those specific elements linking all of this, it will be very difficult for you to address the problem, which somehow it's related to health determinants and human competences. To address this, you need to have a health systems and surveillance. You need to look at the gender, community, equity, and ethics. You need to invest. You need to have a knowledge integration and leadership, and integrated digital health evidence and prediction. And again, here, policy, legislation, and governance. Having said that, I think all of you are well aware of what is One Health, I would like to focus, this is a definition proposed by the One Health high level of expert, which was endorsed by the quadripartite. I would like us to focus on the aims, it's about, the sustainability balance and optimized the health of people, animals. By animals here is terrestrial and aquatic, and the ecosystem. Having this sustainability balance to foster well-being and to tackle threats to health and ecosystem while addressing the collective need for clean water, energy, and air, safe and nutritious food, taking action on climate change and contributing to sustainable development. So this definition echo very well the social ecological system. Again, I have decided to use that entry point to upfront make sure that we can understand the rationale of One Health beyond zoonotic disease and antimicrobial resistance. It's about, again, sustainability, balance, and optimize the health of people, animals, and ecosystem. Now, I will zoom in on the governance, and there are several definitions on a governance. I guess we have different understanding of what is a governance. So it's not about having a consensus about a governance. Is to make sure that we know what is the aim and what is the what is the end result we are looking for when we are talking about a governance. So let me start by this definition. The governance, it's all measures, rules, decision-making, information, and monitoring bodies which ensure the proper functioning and control of a state and an institution or an organization, that it is public or private, regional, national, or international. Okay, measures, rules, decision-making process, information, body to assure proper functioning, but proper functioning of what? Process, decision-making, what is the end goal, okay? Yes, this is from the United Nations Economic and Social Commission for Asia and Pacific. They are focusing here on decision-making process by which decisions are implemented or not, okay? There's a kind of echo with the first definition. Another one, which is from Mo Ibrahim Foundation, with it's about provision of goods, okay? Political, social, economic, and environmental goods, to deliver to the citizens, So all your rules, the measures, your decision-making process, the body you can have, for instance, the One Health platform, at the end is to deliver to the citizens. Deliver goods, political goods, social goods, economic goods, environmental good. We know health, it's part of the social goods. Again, that's why the social ecological system, again, I have chosen that entry point, So the end point it's to deliver on a desired state for social economic system. Again, it's about interaction among actors, and this brings us to the definition of One Health: multidisciplinary, multi-sector approach. At the community, at the rural community, urban community, national level, regional, and international. Interaction among actors, networks, organizations, and institutions that emerge in the pursuit of a desired state. And that desired state is a good to deliver to our brothers and sisters, making sure that the political, social, economical, and environmental good will benefit to our community. All the measures we are taking, the rules, the laws, the policies, the decision-making process, bodies established to help to deliver are going to deliver on that. So again, having this in mind, will, I think, help us to not only better understand different governance level, but most importantly, what is the best governance infrastructure we need for our country to deliver, again, political, social, economic, and environmental goods. So having said that, now I will zoom in again on the governance at the global level. We are all aware of the One Health high-level expert of panel, and which it's an independent, a panel, and the main role is to advise the quadripartite, two main functions: provide policy relevant scientific assessment on the emergence of health crisis arising at the human-animal ecosystem interface, and to address, research gaps, and to guide the development on long-term strategic approach to reduce, risk on zoonotic pandemic. So, that is the functions, the main two functions of the high-level panel, and that panel has, to deliver on those functions. They have proposed a One Health theory of change, and recently there was a white paper on prevention zoonotic spillover. The second elements at the global level, we all know the quadripartite, which is formed by WAHA, WHO, UNEP, and FAO. Last Thursday, there was this second quadripartite executive meeting here in Nairobi. And, all the GGs were there. And there's two levels, in terms of structures. GGs are at the executive level, and there's a secretariat. So the quadripartite has generated a One Health joint plan of action. I believe you are all aware of this document with 6 action tracks. And to support country to implement, the plans, a guide has been developed as well. Other products, generated by the quadripartite is a strategic framework for collaboration on antimicrobial resistance. And this will bring me back a bit. Before the quadripartite, there was the tripartite, and we know that the first starting point of the tripartite was the 2010 MOU between, at that time, OIE, WHO, and FAO. So, and from that, MOU, things are moved until to reach the quadripartite. So in between, the tripartite developed a guide to address zoonotic disease at country level. So I am highlighting this MOU here from 2010 also to show you, the progress, why, even having the quadripartite was an institutional process which has started in 2010. So keeping in mind that institutional process related to what is the best model of governance take times, and it's really critical to understand that that is a dynamic process which is part of also a dynamic context. Now, at the regional level, here is the example of the ECOWAS. The West African community. So this is the model of the One Health platform at the regional level. You can see here that you have, the commission, and you have all the sectors, at least the three main sectors here, and they have senior directors, environment. RAC is the Regional Animal Health Center, the West African Health Organization. So they are all here, okay? And they are interacting with technical partners, other partners, funding partners, and down you have the 15 member states. So in fact, in ECOWAS, the expectation is to have 15 One Health platform, and those member states are represented, at the regional level through these different bodies. And one of the products, again, if you have a governance mechanisms, based on the definition, you have to deliver. So one of the product so far, there's a lot. So I have chosen this one. They have conducted a zoonotic disease prioritization in the ECOWAS region. Now, at the national level, I am zooming again here. I really like this example from China. And the main reason here is, that help us even more to deep dive and to look in a very critical manner, when we talk about governance, don't be surprised if some people are going to use the word governance system. Government system here in China, the One Health government system is built around a legal system, a governmental system, a technical system, and a support system. The article is available, and in a nutshell, they are leveraging on existing system to formalize the governance, the One Health governance system. And I believe it's really important to look at what is already there, to build on what is already there. Of course, there's advantages and disadvantages. However, the sustainability, the sustainability can really come when you are leveraging on the existing system, because we know that in our context, sometimes it's very easy to create, to establish. However, to run the new body sometimes is not easy. So this example, from China, where they first look at what is already there, in terms of what are the existing technical system, in terms of scientific innovation, international cooperation, how all of this, can really help to implement One Health. What is the legal system? They even went to look at what is the Constitution, how the Constitution is related to One Health, how the existing law are related to One Health, how the health sector legislation is related to One Health. Again, is to take stock of what is there and to build its own system. Now, this is so far, this map was generated, I think, more than 1 year ago. At that time, in our continent, there were 22 countries with One Health platform, and you can see here different institutional frameworks were used to establish One Health. But as of now, there's more than 22 countries, and you can see for in some countries One Health has been institutionalized through a MOU, order through an executive order from the Prime Minister, or by executive order from the President, or an executive ministerial order. So a different, institutional framework, but again, that executive order is one of the elements of the governance, right? Now, an example here is in Cameroon, where the platform is anchored, at the Prime Minister level, and the head there is the permanent secretariat of the Prime Minister office, where you have ministers and partners. This is what they call the strategic or the steering committee. Beyond, now you have the technical committee. It's led by a senior officer from the Prime Minister office, and with directors from more than 10 ministries. And below this technical body, you have the operational arms, is the secretariat, where you have One Health focal point from the different sector who are playing the liaison, and to work around those three components. So example, few among other, here is for instance, in Ethiopia, where the platform conducted, a joint risk analysis. In Cameroon, where after, when the 2016 highly pathogenic avian influenza outbreak was closed, a after action review was conducted. And again, it's not to talk about One Health because people are talking about One Health. What is really the added value? How this One Health is contributing to strengthen the system. It's good to do the zoonotic disease prioritization, all the workforce development, all the trainings, but your governance framework at the end of the day, at the national level, should deliver. He should demonstrate that he can contribute to strengthening the resilience of the system. And here, for instance, in 2006, in Cameroon, was the first outbreak, avian influenza, and the government took more than 40 days to confirm the H5N1. 26, they took less than 5 days. Because, since 2010, 12, a platform has been established. There was a lot of preparedness activities in such a way that when the outbreak occurred, they managed to respond more efficiently compared to 2006. Like I said, you can do workforce development, training. At the end of the day, for the minister to invest, for decision maker, you need to provide evidences. So the platform in Tanzania conducted a cost-benefit analysis to demonstrate whether or not, there's really a value, there's a benefit. In the case of Tanzania, there is a benefit. And right now, the One Health platform is working on developing a One Health policy brief using this result to advocate, meaning to discuss with the Ministry of Finance budget to see how they can increase the domestic resources. So again, if we come back to the definition of a governance, it's what goods are you delivering here? You have those rules, you have the platform, you have the decision-making process. At the global, regional, or national level, at the end of the day, it's, let's say, is to make to create conducive environment to make that the optimal health of our community will be achieved. One point to keep in mind, it's governance framework are evolving. You know, this is an example of Tanzania where the trigger was the Rift Valley fever outbreak in 2006, 2007. After almost 6 years, a One Health agenda was launched. And after 2 years, a strategic plan was developed. And then 2018, the One Health Desk was created within the Prime Minister office. Okay, it was a desk. Now the desk has been transformed into a section. You know, this is a demonstration that the framework, what you have established 10 years back, will continue to evolve because the dynamic at the global level, at the regional level, could induce the need, you know, to adjust your governance framework, because you need that governance framework to better deliver on to your community. I am sharing this because sometimes we think because we have established something, it should not be changed. No, things are changing at the global level, regional and national level. And even the dynamic among the three levels, the governance at the global level might influence the governance at the regional level, and the regional can influence the sub-national level, like the regional economic communities, and then that sub-national can even influence the national framework. So all of this bring us to the importance, you know, if you are influenced, it's how are you engaging stakeholders from public sector, ministries, universities, from the private sector, civil society organization. So it's the stakeholder engagement here again, if we are very clear on our common understanding of the governance. It's not only, again, about the rules, the decision makings, the body you have established. My point here is you need to keep in mind to deliver on what, okay? To deliver on what? Is it a bottom-up approach or up-down approach? So if that is clear for you now, you can understand why the stakeholder engagement is very important. For instance, there's a country where, you know, through this stakeholder engagement, you know, a network of civil society, One Health organization has been created. And the main reason here is the platform realized that if they want One Health need to be implemented at the rural, at the grassroots, and that the civil society has a very strong roots there, so they can convey those messages, awareness, sensitization. But to bring those partners, and that is also for me a very important point. Yes, we have the definition of One Health. But to bring people together is because you want to do a One Health interventions. So a One Health interventions, I think if we understand this, I strongly believe that our governance framework will be better shaped, and the implementation of that governance framework will be easy. Because if we understand again, what is One Health intervention and the characteristic of a One Health interventions, that will be very helpful. So a One Health intervention is an activity generally undertaken by at least two sectors, engaging multiple disciplines aimed at improving the efficacy and efficiency of different animal, human, plant, environmental system services. You know, it's about services. Your governance mechanism should deliver best services. So if you want to really embrace a One Health governance, if you want to have all the stakeholders around the table, you should really consider, in addition to the definition of the One Health approach, what is the intervention? Because that intervention has a specific characteristic. It should be multi-sectoral and multidisciplinary initiative where there's a mutual interest, mutual benefit to resolve, to address a health challenges. Mutual benefit does not mean equal, okay? But there's a mutual benefit. I have an interest to be around the table. There should be joint activity, participation, and collaboration evidenced by equal partnership through joint investment, plan, resource mobilization, joint programming, planning, rolling out, monitoring, and evaluation, and most importantly, co-learning. That's why the co-learning is also a benefit. Share resources, including technical, personal, and financial, and joint definition of measurable deliverables. Again, is what this governance system is delivering. So we are almost there. There's challenges. Okay, there's challenges here, and it's political, institutional, technical, and structural challenges. And it's important to keep in mind that understanding the One Health definition is very important, and you should continue to create awareness and to contextualize the understanding of the approach. You need to understand that the global and regional dynamic can influence how your institutional framework will evolve. And of course, leadership, resource mobilization. And on technical aspect, you need more integration of climate, aquatic, animal health, plant, soil, and to demonstrate the added value related to the IHR and the PVS. So at the end, it's about investing, at the early stage here, One Health investment and One Health preparedness and intervention to make sure that when you have an outbreak, the activity skills are already at an optimal level, and then you can mitigate the public socio-economic impact. Thank you.